With more than 18 million cases around the world, cancer remains the second leading cause of death globally and one of the most actively researched diseases of all. To combat this enduring global pandemic, gathering accurate and high-quality data is an utmost priority. Information about an individual's biology, behaviors, lived experiences, and environment, along with their respective interactions, are all crucial to research the causes of cancer and the genesis of disparate health outcomes for different populations. The VCU Massey Cancer Center recognizes the importance of accessing, understanding, and sharing data that represents the rich diversity of our catchment area. To better understand Massey's commitment to cutting-edge cancer care and community-responsive research, let's get to know a little more about the VCU Massey Cancer Center. The VCU Massey Cancer Center is among the top cancer centers in the U.S. and is officially designated by the National Cancer Institute to lead and shape America's cancer research efforts. The National Cancer Institute, NCI, is the federal government's principal agency for cancer research and training. NCI is part of the National Institutes of Health, NIH, with a mission to lead, conduct, and support cancer research across the nation to advance scientific knowledge and help all people live longer, healthier lives. Massey Cancer Center, or MCC, is one of the oldest NCI-designated cancer centers in the nation, and one of the first to receive this recognition of excellence. This ensures that we fulfill our vision to lead the nation in discovering the most effective approaches to preventing and treating cancers, particularly cancers that impact the most at-risk populations. Data is the organizing principle to it all. It sets MCC's research, outreach, and engagement agenda to ensure our efforts and discoveries are responsive to and aligned with the needs of the communities we serve. This is the dynamic data we derive and apply from the diverse people we serve in our catchment area. Now let's take a look at what is defined as the MCC catchment area. As the Cancer Center for Virginia, Massey provides care for all Virginians. However, for the purposes of prioritizing our research and outreach efforts, the MCC catchment area is defined as the areas that are most likely to have cancer that is diagnosed and or treated at Massey. It encompasses 66 of Virginia's 133 counties and independent cities, spanning the eastern, central, and southwestern portions of the state. Our catchment area is the underpinning of everything we do. It prioritizes our research, guides our efforts, and galvanizes our commitment to the communities we serve. The catchment helps us to define areas of research and refine the questions that our amazing scientists are asking to maximize our impact in the communities we serve. And why is the Massey catchment data so essential for impactful research? The answer is diversity. The 66 counties that encompass our catchment in the eastern, central, and southern part of the state are home to over 4 million racially, ethnically, geographically, and socioeconomically diverse individuals. In fact, our catchment encompasses communities that range from completely rural to fully urban, including 12 of Virginia's 21 most rural communities. It is also home to the majority of the African American population in the state of Virginia. This very same population also experiences higher rates of some of the most common cancer risk factors relative to the U.S. and to the rest of the state of Virginia. In fact, there is a 25-year life expectancy gap in Virginia, and our catchment area includes the city with the lowest life expectancy statewide. This catchment area has the unfortunate distinction of including the cities and counties with the highest rates of obesity, smoking, food insecurity, diabetes, excess drinking, and HIV in the state of Virginia. Also, 55 of the 66 catchment area localities are classified as medically underserved areas and therefore have less access to regular medical care. Therefore, it is not surprising that this very same population is also disproportionately afflicted with a higher cancer incidence and mortality compared to the U.S. and to the rest of the state of Virginia. This translates to 600 more cancers and 200 more deaths each year in our catchment area than in the rest of the state. The COVID-19 pandemic will only widen existing gaps, as it has already started impacting access to critical cancer screenings. But Massey remains steadfast in its commitment to cancer care health equity, and it is precisely in this catchment area where our research and community outreach and engagement efforts are focused. VCU and MCC not only bring you closer to the community through data, but also through partnership via our community outreach and engagement efforts. COE is grounded on the principles of our community to bench model, to address the cancer burden via a bidirectional outreach and engagement of the researcher and the community, open data sharing, and healthcare policy change. Through COE, we provide local support via our community research and resource centers and have put forth a national network as part of the NCI's Community Oncology Research Program, bringing clinical cancer trials and care delivery studies to people in their own communities, ensuring everyone, regardless of race, ethnicity, geography, or socioeconomic status, can access these latest advances in cancer care and research. To ensure easy data access and transparency, much of the data we use to learn about our catchment is readily available at maps.healthlandscape.org/Virginia, where you can get detailed information on numerous health indicators across various geographical areas. Lead your research, outreach engagement, and development efforts in Virginia with accurate data from the MCC catchment. Your research can potentially lead to a path to a cure. Our data can accelerate your path. For more detailed information about the Massey catchment, please contact the Office of Catchment Area Data Access and Alignment today.